Labiaplasty is the alteration of the shape and size of the labia. This includes both the large and small labia. We classify labiaplasty as a branch of plastic surgery. It is divided into two types. These are surgical alteration of the shape of the small labia and contour labiaplasty, which is the filling of the large labia with fillers. What are the indications for labiaplasty? There are, of course, no absolute indications for labiaplasty. Why are there no medical indications, and for whom would this surgery be recommended? First and foremost, it is the patient's desire to change their appearance, let's say their aesthetic appearance. It can also be due to discomfort during sports, wearing underwear, or certain aspects of intimate relations. A relative indication would be a congenital anomaly, such as asymmetry. This includes asymmetry of the labia minora, postpartum tears, defects, traumatic or age-related changes, when the labia minora lose their shape and no longer look the way perhaps a woman envisions them. So, what can we say about the patients who come to us with questions or a desire to undergo this procedure? These are women from 18 years old and women over 60. Now is an era when women have started taking care of themselves so much that a woman at 40 or 50, it's wonderful that this issue can also be a concern. That's why we are often approached by women who are 50 plus and 60 plus. And of course, we do our best to make their lives as comfortable as possible. How is preparation for labiaplasty surgery carried out? 3 to 5 days before the surgery, general clinical tests are done. This includes a complete blood count, coagulation test, liver function test, discharge analysis, and an electrocardiogram. The surgery itself is performed under general anesthesia. There is a percentage of patients who insist on having local anesthesia, and if it is possible, we accommodate their request. There are two types: edge labiaplasty and wedge labiaplasty. Of course, we consider the patient's anatomical features and make a choice accordingly. Before that, we discuss what the patient envisions and what goals they set for the doctor. After marking, we excise the excess tissue of the labia and place removable sutures. The post-operative period is generally quite easy. 3 to 4 hours after the surgery, we discharge the patient from the clinic and recommend coming back in 2 days for a dressing change. We assess the condition of the sutures. At home, the patient takes care of the sutures independently, which do not require any special care. If we consider the issue of pain, then after the operation and during the subsequent period, painkillers are not needed. What restrictions do we need to inform the patient about before the operation so that the woman understands what limitations await her? First and foremost, this concerns physical activity. For 2 weeks, the woman should refrain from sports, and restrictions on intimate life last for 3 weeks. One of the questions is whether the surgery affects the quality of intimate life. It can only improve sensitivity. In fact, it can only change the quality of intimate life for the better. Why is that? Because this kind of operation gives a woman a sense of comfort, self-confidence, and care addressing the concerns she came to us with. As a rule, these are aesthetic concerns. A frequently asked question is whether it is possible to simultaneously change the shape of the labia minora and give a new shape to the labia majora. Indeed, we combine surgical techniques, reshaping the labia minora by removing excess tissue, and through contouring with fillers, we give the labia majora the desired appearance.